Ever wondered why understanding ECGs is crucial in cardiology? Let's take a moment to explore the fascinating world of electrocardiography, commonly known as the ECG. This is a graphic representation of the heart's electrical activity, recorded right from the surface of the body. Picture a graph in your mind. The horizontal axis of this graph represents time. One small square, or 1 millimeter, equals 40 milliseconds. When you expand that to one large square, or 5 millimeters, that equals 200 milliseconds, assuming a paper speed of 25 millimeters per second. Now let's shift our focus to the vertical axis. This represents voltage. So, one small square, again 1 millimeter, equals 0.1 millivolts. If you look at 10 millimeters or two large squares, that equals 1 millivolt, and this is at a standard gain setting. When we talk about ECGs, we usually refer to the standard 12-lead ECG. This includes limb leads labeled as I, 2, 3, AVL, AVR, and AVF. Additionally, there are precordial leads, which are V1 through V6. To break it down further, V1 and V2 are septal, V3 and V4 are anterior, and V5 and V6 are lateral. But the story doesn't end here. There are additional leads too, specifically right-sided leads, which are V3R through V6R. These are particularly useful in diagnosing right ventricular infarction and dextrocardia. Now that was a lot of information, wasn't it? But don't worry, understanding the basics is the first step in unraveling the mysteries of ECGs. As we continue our journey, we'll delve deeper into this complex world, learning to decode the ECG rate, understanding the rhythm, and deciphering the axis. With these basics, you're on your way to understanding the complex world of ECGs. Now, how do you decipher the rate on an ECG? The rate, in terms of an ECG, refers to the speed of the heartbeat. Normal heart rate usually hovers between 60 to 100 beats per minute. When the atrial rate shoots up to between 150 to 250 beats per minute, we're looking at paroxysmal tachycardia. If the atrial rate is between 250 to 350 beats per minute, it's atrial flutter. Anything above 350 beats per minute, we're dealing with atrial fibrillation or AFib. Now, to calculate the rate, you'll have to consider whether the rhythm is regular or irregular. If it's a regular rhythm, divide 300 by the number of large squares between two QRS complexes. You may ask, why 300? Because there are 300 large squares in 1 minute. Or if you're more of a mnemonic person, remember this sequence. 300, 150, 175, 60, 50, 43. As the number of large squares between two QRS complexes increases, the rate falls in this sequence. For an irregular rhythm, the rate is calculated as 6 times the number of RR intervals in 10 seconds. Now, you might encounter some irregular rhythms such as a wandering pacemaker, multifocal atrial tachycardia, or AFib. And then there are escape rhythms. For atrial escape, the rate is between 60 to 80 beats per minute. For junctional escape, it's between 40 to 60 beats per minute. And for ventricular escape, it's between 20 to 40 beats per minute. Remember, the rate is just one piece of the puzzle. Let's move on to understanding rhythm. What does rhythm on an ECG mean, and why does it matter? The rhythm on an ECG is the pattern of heartbeats, the sequence of electrical events that occur from one heartbeat to the next. It is crucial because it tells us whether the heart is beating in a consistent regular pattern, or if there are any irregularities that may suggest a heart condition. There are 4 types of rhythms that we might see on an ECG: regular, irregular, regularly irregular, and irregularly irregular. In a regular rhythm, the RR interval, the time between 2 consecutive R waves, is the same across the tracing. This means the heartbeats are evenly spaced, like a metronome. However, if the RR interval changes from beat to beat, we have an irregular rhythm. It's like a drummer who can't keep time. The beats are unpredictable and uneven. This could be a sign of a number of conditions, such as atrial fibrillation or heart block. Regularly irregular rhythms have a repeating pattern of varying RR intervals. Imagine a waltz with a rhythm of 1-2-3, 1-2-3. The beats are not evenly spaced, but there is a consistent pattern to the rhythm. Then there are the irregularly irregular rhythms where the RR intervals vary erratically, like a piece of freeform jazz. There's no discernible pattern to the rhythm, which can be a sign of serious conditions like atrial fibrillation. A normal sinus rhythm, or NSR, is what we like to see on an ECG. This is when the heart's natural pacemaker, the sinus node, is setting the rhythm. On an ECG, an NSR shows a P wave, the first small bump, preceding each QRS complex, which is the main spike on the graph. The The QRS complex follows each P wave. The P wave axis is normal, meaning it's positive in leads I and AVF, and the rate is between 60 and 100 beats per minute. Understanding the rhythm of an ECG is like learning to read the rhythm of a piece of music. It tells us how the heart is beating and can reveal a lot about the health of the heart. With rhythm figured out, we're ready to tackle the final piece, the axis. Ever heard of the axis in an ECG? Let's demystify it. In the world of electrocardiography, the term axis refers to the mean direction of the electrical activity of the heart. It's like a compass for cardiac activity, guiding us to understand the general direction of electrical forces within the heart. The axis can be determined for any waveform, P, QRS, or T. But most commonly, when we speak of the axis, we're referring to the QRS complex, which represents ventricular depolarization. Now, the QRS axis can be looked at in two planes, the frontal plane and the horizontal plane. Let's break these down. In the frontal plane, the QRS axis is usually between -30 degrees and 90 degrees. This is considered the normal axis, and it means that the electrical activity is moving in a positive direction in leads 1 and 2. However, sometimes the axis deviates from this normal range. If the axis is less than -30 degrees, we call it left axis deviation, or simply LAD. On the other hand, if the axis is more than 90 degrees, it's known as right axis deviation, or RA. The axis in the horizontal plane, on the other hand, isn't routinely calculated, but it's good to know that it generally points to the left and slightly backwards. The transition from a negative to a positive direction usually happens in lead V3, so, in essence, the axis serves as a useful tool in interpreting the ECG. It not only gives us a snapshot of the overall direction of the heart's electrical activity, but also alerts us to any significant deviations that could indicate underlying pathology. Understanding the ECG axis might seem a bit daunting at first, but with practice, you'll find it's an invaluable skill that adds depth to your ECG reading abilities. Congratulations, you've now learned how to read an ECG. Scene script. Let's revisit what we've learned today. We started with the basics of electrocardiography, or ECG, which is a graphical representation of the heart's electrical activity. We discovered that the horizontal axis on the ECG graph represents time, while the vertical axis represents voltage. We also learned about the standard 12-lead ECG, which includes limb leads and precordial leads, as well as additional leads like right-sided leads. From there, we dove into the approach to ECGs, beginning with the rate. We learned that a normal rate is 60 to 100 beats per minute, and we explored how to calculate both regular and irregular rhythms. We also discussed different types of rhythms like wandering pacemaker, multifocal atrial tachycardia, and atrial fibrillation. Next, we examined the rhythm. We learned about regular and irregular rhythms, as well as regularly irregular and irregularly irregular rhythms. We also explored the concept of normal sinus rhythm, where a P wave precedes each QRS, and a QRS follows each P wave, with a rate between 60 to 100 beats per minute. Finally, we looked at the axis, which indicates the direction of the mean vector. We learned that it can be determined for any waveform, such as P, QRS, and T. We also discussed the standard ECG reported QRS axis, which usually refers to the mean axis of the anterior plane. We learned about the QRS axis in both the frontal and horizontal planes, as well as left and right axis deviations. These are vital tools in understanding the overall picture of a patient's heart health. Each element, the rate, rhythm, and axis, contributes to a comprehensive understanding of what's going on inside the heart. Remember, mastering ECGs takes practice. Keep studying, keep questioning, and keep saving lives.